Welcome to the explainer that completely decodes what your blood pressure pill is actually doing inside your body and how you can take absolute control of your cardiovascular health. Whether you were just prescribed these medications last week or you've been taking them for literally decades, understanding the hidden mechanics behind them is an absolute game changer.
Picture your morning routine for a second. You stumble out of bed, maybe grab a quick glass of water, and you swallow your blood pressure pill. You've probably been doing this exact same thing every morning for months, maybe even years. But here's my honest question for you. Do you actually know what it's doing inside your body right now? And I don't just mean, it keeps my doctor from yelling at me. I mean the actual, biological mechanism. Because once you understand that, suddenly, those strange swollen ankles or that lingering dry cough you've been having start to make complete, totally logical sense.
All right, so here's our roadmap for this explainer. We're going to start with unlocking your blood pressure pills, followed by making sense of side effects. Then we'll uncover some hidden dangers in plain sight, lay out a crucial sick day protocol, teach you about measuring the right way, and finally, we'll look beyond the pill. Let's get right into it.
Section 1. Unlocking your blood pressure pills. Mechanisms demystified.
We're going to look at the 3 absolute most common medications prescribed today. And honestly, they're not just generic, interchangeable little pills. They operate through completely different pathways in your body. First up is Amlodipine. This one is a calcium channel blocker. See, calcium tells your muscle cells to contract. And since your arteries are lined with smooth muscle, amlodipine steps in and blocks that calcium. It literally forces your arterial walls to relax. Think of it exactly like unclenching a tight fist that's been gripping a garden hose. Then we have Lisinopril, which is an ACE inhibitor. Your kidneys naturally produce an enzyme that manufactures this highly constricting hormone called angiotensin II. Well, lisinopril simply blocks the manufacturing plant. No enzyme means no constricting hormone, which means less pressure. And finally, Losartan, an ARB. Now with Losartan, your body still makes that constricting hormone, but the receptor, basically the biological front door that the hormone needs to knock on, is locked tight. So it's the exact same destination of lowering your blood pressure, but 3 completely different routes to get there.
Moving on to Section 2, making sense of side effects, normalizing the abnormal.
Let's connect the dots and see how knowing these mechanisms completely changes our understanding of side effects. Let me tell you about a 71-year-old patient named Arthur. Arthur was on Amlodipine for 4 years, and his blood pressure numbers were fantastic. But the guy was absolutely miserable. By 7 p.m. every single day, his ankles were so swollen he literally couldn't get his shoes on. He quietly convinced himself his heart was failing. But here's the truth. That is just physics. It is not your heart failing. Because Amlodipine relaxes your arteries much more efficiently than it relaxes your veins, more blood rushes down into your feet than your veins can pump back up. The fluid just sort of pools in the surrounding tissue. That's gravity doing its thing. If your swelling is in both ankles, worse at night, and gets better by the morning, it's almost certainly an amlodipine effect, not a failing heart.
Which brings us to another crazy mystery. Meet Patricia. She was taking lisinopril for nearly 2 years, doing perfectly fine until out of nowhere she developed this maddening, dry, tickly cough. And over-the-counter antihistamines, they didn't even touch it. Why? Because lisinopril causes a buildup of a chemical called bradykinin right in your airways. And the wild part is, it can sneak up on you weeks or even months after you first start the pill. It severely wrecked her sleep, but thankfully, it wasn't actually dangerous. Her doctor simply switched her over to Losartan, which, remember, works way downstream at the receptor level and doesn't cause that bradykinin buildup at all. Her cough was completely gone in 2 weeks.
But listen closely, because here is where we absolutely need to draw a hard line. While a dry cough is just a benign nuisance, angioedema is not. This is a swelling of the lips, tongue, or throat that causes your airway to actively tighten. If you are ever on lisinopril and you notice any unusual facial swelling or a terrifying sense of your throat closing up, that is a rare but completely life-threatening emergency. Do not wait for your next scheduled appointment. Call emergency services immediately. You have to know the difference between a harmless dry tickle and a tightening airway.
Section 3. Hidden dangers in plain sight. Dangerous combinations.
We really need to talk about how seemingly healthy choices or super common over-the-counter products can suddenly turn into highly dangerous combinations.
Take Bernard, for instance. He's 74, on Losartan. His well-meaning daughter wanted to help him eat, heart healthy, so she brought home a low-sodium salt substitute and some fancy hydration electrolyte tablets. But here's the catch. Most salt substitutes replace regular salt, sodium chloride, with potassium chloride. So you're not just getting less salt, you're getting a completely different chemical entirely. You are getting pure potassium. And Bernard was sprinkling massive amounts of it on all his food.
And here's why that is such a big deal. Medications like Losartan and Lisinopril already tell your kidneys to hold on to more potassium than usual. That's just how the drugs function, and normally, totally fine. But when you combine them with highly concentrated supplemental potassium, like those heavy salt substitutes or sports drinks, your potassium levels can absolutely skyrocket. For Bernard, this actually triggered severe muscle weakness and really dangerous cardiac arrhythmias, which are abnormal heart rhythms. The saddest part is, it was completely preventable. Always check your labels for potassium chloride.
But the hidden dangers don't stop at the grocery aisle. They're probably sitting in your medicine cabinet right now. If you've got bad joints and you're popping common NSAIDs, like ibuprofen or naproxen, every single day, you need to know they interact directly with your blood pressure meds. They actually force your kidneys to retain sodium and water, which actively raises your blood pressure, completely undoing the work of your prescription. Even worse, they physically restrict the internal blood flow within your kidneys. Add a hot, sweaty, dehydrated day to that mix, you can severely and permanently damage your kidney tissue. Look, popping one occasionally for a headache is usually fine, but daily use, you absolutely have to have a chat with your doctor.
All right, Section 4, the sick day protocol. What to do when you're ill.
Picture this. You come down with a terrible stomach bug, severe vomiting or diarrhea, and you just can't keep any fluids down. You might naturally think, well, I need to be responsible. Let me force down my blood pressure pill. Don't do it blindly. When you are that severely dehydrated, your overall blood volume drops significantly. If you take your medication, which remember is calibrated for a fully normally hydrated body, it can plummet your blood pressure to critically low, dizzying levels. And that dangerously starves your kidneys of the pressure they desperately need to filter properly. If you find yourself in this situation, first, recognize the severe dehydration. Then, pick up the phone and call your doctor or pharmacist. Ask them specifically if you should hold off on your dose until you're properly hydrated again. Be a proactive patient. Make that call.
Section 5. Measuring the right way. Avoiding false alarms.
Look, blood pressure is not just some static, fixed number. It is moving constantly. It spikes the second you stand up. It spikes when you have a full bladder. It even spikes when you've just hung up a stressful phone call. So, a single high reading on a random Thursday afternoon is basically meaningless. What your doctor actually cares about is a pattern collected correctly. So, follow this exact protocol. Sit quietly for 5 full minutes. Don't check your phone. Use the exact same arm every single time. Take 2 readings, spaced exactly 1 minute apart. Then record that daily average over 3 consecutive days. Only a consistent 3-day pattern of resting averages gives you real medical value. Otherwise, a single high reading just creates anxiety, which, guess what, raises your blood pressure even more, trapping you in this vicious cycle of false alarms.
And finally, Section 6, Beyond the Pill, the system versus the gauge.
Let's be real. These pills, Amlodipine, Lisinopril, Losartan, they are remarkable. They prevent strokes, they prevent heart attacks, and they undoubtedly save lives. But we've got to understand something fundamental here. The medication is simply managing the gauge. It regulates your daily pressure numbers, but it does absolutely nothing to fix the system. The underlying system is the actual physical stiffness of your arterial walls, the chronic low-grade inflammation bubbling in your tissues, the overall daily workload on your heart. That system is dictated entirely by what you eat, how consistently you move your body, and how deeply you sleep. The medication, it just manages the dial on the dashboard. Your daily lifestyle is what actually rebuilds the engine.
So I really want to leave you with this thought today. Are you just swallowing a pill every morning and hoping for the best, or are you an active, informed participant in your cardiovascular care? Patients who fully commit to sustained lifestyle changes often come back to their doctors months later with readings 20 points lower, allowing them to carefully, safely reduce their dosages over time. Now, hear me loud and clear on this. Never, ever stop taking your medication without your doctor's explicit supervision. Don't do it. But please realize that understanding exactly how your medication works is the very first step in becoming a true partner with your doctor. You have the power to completely shape your holistic health journey. So step up, ask the tough questions, read those ingredient labels, and start actively participating in